everyone, welcome to PHAMCAST. I'm your host, Margaret Wallace-Duffy, and the founder of the Preventative Health Awareness Month, which takes place every February, and movement, because changing your health and preventing illness is a lifelong thing. You know, I absolutely love being able to have heartfelt conversations, soulful conversations, empowering conversations, because I get to learn and grow every time I have a new guest on the show. And one of the things I love most about this preventative health movement, and the now over 83 healthcare professionals from all of the disciplines that are part of the preventative health movement, is not only do I get to continue to learn from them, but I get to connect the healthcare professionals and watching the magic that happens in patient outcomes and moving this mission forward. And today, though, I get to welcome back into studio not only somebody who I admire greatly, who I've learned a ton from, who's been a friend, a colleague, my behavioral optometrist, and really a community pillar in our community in the Halton Hills area, who's been practicing for 31 years. Dr. Carolyn Teske is in the house. How are you?
I am so excited to be here. Thank you for inviting me back.
You know what? I love having you here. I love working together with you. We were just talking off camera about the fact that it's been, well, years and years. I mean, I remember doing television with you, 25 years ago? Something crazy like that?
Long time.
And you like putting your heels in and going, oh, no, I don't want to go on TV. What is that? I don't want to do that. But what I felt right away from you was your heart and your commitment to patient care and your commitment to your own growth as a person and as a professional. And those are the types of people I love to hang with, because I learn from them, I grow from them. And you challenge me in ways. And I've learned so much from you as an optometrist. Here I am, a massage therapist, and working alongside, I'm proud to say, I don't think this has ever happened, that a massage therapist actually was doing treatment inside your optometry clinic because we could. Because we believed that we could break down silos and that we could be better together. Can you just speak to that right off the top, Dr. Teske? Because you leaned in and gave me that opportunity. And I know you probably took some heat for it. There were probably people saying, why would you do that? Why is there a massage table in the back room? You had the guts to do it, but why?
You know, I think we both share the same passion that the body's a whole. Yeah. And when you treat one part of the body, then you'll impact the other part of the body. Right. So I think one of our star patients was a diabetic.
Oh my gosh, yes.
Right? That they were ready to amputate her limb. And you know, with the success that your treatment gave, and my identification of her diabetic poor circulation, you know, she still is walking today.
Oh my gosh. Yeah, talk about a better together story. I mean, we literally, you referred her to me. You always talk about the eyes being a window to your health, to your body, and often disease is seen in the eyes first, or when it's late disease, and we're going to talk about that in a little while, about prevention. But what I loved about what you did is you gave me the opportunity intercollaboratively to treat her with my skill set, in my wheelhouse, in my area of expertise, with massage therapy and microcurrent point stimulation therapy. And literally in front of both of our eyes, I remember leaving that treatment room in your clinic and booting down the hall. You were seeing patients, because I was dying to come and say to you, I can't believe what I'm seeing with the one treatment what I was seeing. But it was because we were working together. And how cool was that feeling for you? Like, it's so neat to look at those types of cases.
Absolutely. You know, education has always been a passion, but when you can enhance other people's lives by sharing information, introducing them to other healthcare practitioners, you know, the eyes really will reflect the nervous system, right? So, you know, we overlap in microcurrent,
yes,
but the circulation system, you know, the lymphatic system,
yes,
autoimmune system, you know, I think as the window to the rest of the body, we really can help make change.
Well, and that's why for years, you know, I saw that in you in the way that you treated me as your patient, but then always educating, always going above and beyond. Yes, giving me good, you know, optometry care, but then you were saying, okay, so what about what you're eating and what's your stress like? And truly being an active listener and a encourager, really. And that's what, and a passion for education is what drew us together. So not only has Dr. Teske been a FAMCAST from the very beginning, we had did a three-part not hormonal health, that was with Dr. Prowse, a three-part eye health series together where we, looked at seniors and glaucoma and cataracts and prevention from that lens, pun intended. We even did, how cool was this? We even went in the OR to see a cataract surgery being done with Dr.
Dean Smith.
Dr. Dean Smith,
Yeah.
one of the leaders, and Dr. Ike Ahmed, who's one of the global leaders in
Number one ophthalmologist in the world.
Incredible.
Yeah, passionate.
And we were doing that 10 years ago, Dr. Teske, bringing all bunch of people to the table thanks to your leadership from the lens of eye health. And I've learned so much from that and your willingness to lean in and learn and grow. Can you tell everybody, because I think this is really important now that we're entering into this 4th year of preventative health movement, before FAM existed, and we were doing lots of speaking together and various things, we embarked on a study together. Can you talk a little bit about that? Because we've got more to tell in that story.
Sure. Of course, you introduced me to microcurrent and the principle of applying energy through acupuncture channels to be able to increase wellness. And I happened to be at a behavioral optometrist training seminar, and Dr. Ben Thompson was speaking to us about his study where they were using an apparatus on the brain delivering microcurrent to improve vision in lazy eyes. So I quickly messaged you, and you replied and said, "Is this the same microcurrent?"
Yeah, it was so cool. Yeah, because a massage therapist introducing you to microcurrent, then you're sitting in an optometry conference and you're hearing about microcurrent, but then you're the type. So not only do you learn, you take action. So then, what happened next?
So I approached Dr. Thompson about bringing research to clinic. So we did. It was 5 days of application of current to the brain through his apparatus. A PhD student did it to my real patients.
Amazing.
And we got results. We published the data. The part B of the study was going to happen, but then COVID did.
Right.
Exactly.
So it was so encouraging and so neat to see in real time in clinic, which doesn't happen often where you're bringing research into a clinical setting, and collaboration, massage therapists and optometrists, to see true change with people's vision, which is so cool. And like you said, then COVID hit. But we have an announcement to make, which we're so excited about. That study, Part B, it's happening.
Yeah,
Tell us about
absolutely.
it.
So we now will be embarking on Part B of the study, which not only will include, university-generated equipment, but also Dolphin, the tool that is handheld, Health Canada approved, and in patients' hands. So we'll also, of course, have a placebo. So
of course.
We'll, I think through all of this, certainly you've experienced it as I have. Your voodoo, as others describe it, does it really work, right? And I think that's my passion to do this Part B of the study.
Yes.
Not only will it work, but I think with Dolphin we're going to see an amplified effect.
I love that, and proper protocols and in collaboration, and like you said, a sound study and linked to a university. I mean, this is how integrative health and preventative health moves forward. This is how we change the legacy of healthcare. So it's really neat to see sort of, how this has progressed both in our relationship, our friendship, and our professional collaborations. You've introduced me to people, I've introduced you to people, you've introduced me to tools, I've introduced you to tools. That's what true Better Together care is all about, and what we love most is being able to put it in the hands of patients to do things to help themselves. Before we talk about another project, because you're always innovating, and I love this, another example came to mind where you taught me so much, and it was so cool in real time to see it when I was working in your office. There was a patient that had a tumor removed from her head. Can you talk a little bit about that and how she presented, and then how you brought me in to use the microcurrent, and then the results of that, and then I'm going to share what I learned.
For sure. So it was an acoustic neuroma that was removed, and as a result of the tumor removal, which had to happen, the facial nerve was damaged, and she didn't have a whole lot of tears. So her eye was very dry and irritated, and for years I would treat that and we would try and manage it, but there was really no success at teaching her body to make more tears without any kind of, we were just supplementing. We were band-aiding the problem.
And it was impacting her well-being in her life because her eyes were,
Absolutely.
open, they were dry, they were itchy. She explained to me when she went to get her hair, women that when we go to get our hair washed at a salon and they're massaging her head, it would hurt because of her scar in her cranium. And so you, with your foresight, with your willingness to learn and collaborative approach to care, said, Margaret, what if you did a scar release on the incision? And what if you did a protocol on her face just to see what might happen to reduce inflammatory response, to wake up facial nerve 5? Who knows? And we were both knew that nothing could hurt. The patient was game, and so we did. And I will tell you, I was blown away in real time. Her husband stayed in the treatment room, happy to have him. She was happy to have him there. And they'd been through so much. It'd been how many years, Dr. Teske? Years,
decades.
right? She'd been living like this for a very long time, so it was part of her normal. And I managed her expectations, both of us did. We didn't know whether this could do anything, but we certainly knew that it wouldn't hurt. But what if it could help? And so I did the scar release on her incision in her head. And then I started to work on her eye, both the unaffected and the affected eye that was open. And as I'm watching, as I'm treating, I start to see a tear come down her cheek. And her husband's looking at her, and she's looking, and she's like, oh my God, what's that? And I said, that's a tear. I said, are you okay? She said, yes, but that's a tear, and she got emotional. I said, it is. Now, here's the neat, teachable moment that you did for me. As a massage therapist, I know muscle and bone and nerves, but I don't massage eyeballs for a living. I certainly know nerve innervation, and I understand the connection as you do of all the systems working better together, or not. But I really, I love to learn. I want to learn. So I had to go get you, and I said, you got to see this. You got to come and see this. This was first treatment. And I said to you, Dr. Teske, but why is she creating tears? And you talked about the lacrimal gland. Mm-hmm. Share with everybody what you taught me that day. And of course, it made perfect sense. And that's how you together learn as clinicians from one another to better a patient's outcome.
For sure, yeah. The microcurrent stimulated the lacrimal gland to produce tears, which she had not had in decades.
Oh my gosh. And that was because of the nerve innervation of facial nerve 5. Mm-hmm. Come on.
It works together.
This is better together. And that's why an optometrist and a massage therapist, it makes sense to work together. If you're willing to think outside the conventional box and stay within our lanes, because she knows what she knows, I know what I know, but together we can do great things. This is what I love about you, and you're always willing to look at, but being scientific and wanting to make sure we do no harm first and patient empower and educate. But you're always also looking ahead. What else? And you personally as a human, not only are you an incredible mother of 3 unbelievable kids, well, grown adults now. We're not little, we don't have little kids anymore, but 3 grown, incredibly successful adults. You're a community giver, you're an educator, you're also Métis. And you believe in inclusive healthcare, which I really love. And that's what FAM is all about. It's inclusivity from pregnancy through to palliative care, all walks and ethnicities of life, all sexual orientations. We're here to help everyone. Tell us about a new project that you're now, I'm not surprised, but that you're now part of, and how excited I am. And I hope that the preventative health movement can help amplify this message or even contribute to it moving forward.
So along the same lines of Better Together, 2020, I partnered with FYI Doctors, which is the largest doctor-led, doctor-owned partnership in North America. Very like-minded individuals that really have partnered to do better together. So that organization, so FYI Doctors, CEO Dr. Al Ulsifer always had a passion to try to give back to Indigenous communities, in particular optometry, that really isn't well represented in Indigenous care. So his dream was to build a mobile clinic.
Wow.
So just in July of 2025, our first mobile clinic was built and is in Alberta. We've already had many activations to local communities, Goodwill centers, and I was asked to be involved in leading the Indigenous care that will hopefully start in May or June or early spring. The goal, hopefully within 5 years, we will have a mobile clinic in every province.
Oh my gosh, so bringing care to needed communities where they're underserviced, and from a preventative lens, and we're going to talk in the next couple of segments about that, eye health can be such a window to all health and prevention at its best. Yeah. What an impact that can make on an entire community and generations.
Yeah, I'm so excited.
Oh my gosh.
As an homage to my dad, who was Métis and really didn't ever embrace his history, because of course he grew up in the world where we didn't talk about that.
Right.
We were shamed into not acknowledging it. So this is my gift back.
Oh, I just love that. And that just speaks to what your heart is. You're a heart-wired practitioner, and that makes a massive difference. And rest your dad's soul. I had the privilege of meeting both your parents, and my father as well, no longer with us. I really feel that we're making generational impact, and that's really, really cool, and it will ripple to so many others. Before we break, I just have to tie into this whole mobile thing, which I think is so cool and make it accessible. When I started massage therapy 34 years ago, I had a vision of having a mobile clinic. And you got to remember, back then I wouldn't even hang my diploma in massage therapy, even though I'd been to University of Waterloo, because it said masseuse. And I'm not a masseuse. I'm a proud, registered, regulated health professional. And I had a vision. But 34 years ago, my vision wasn't where massage therapy is today, but I knew we could get there. But I wanted to have a mobile massage therapy clinic. And then, when I sold my clinic, it'll be 4 years this April, can you believe it? It's gone that quick. With mad success and breaking down silos, I've had the privilege of also collaborating with another amazing forward-thinking business, Osteosound, shout out to Megan, and bringing a new bone scan to Canada from Europe that's changing the game in musculoskeletal health, which is my passion. And we do REMS on the road, taking the REMS bone scan to all different communities. So it just fires me up because I've wanted to have a FAM bus so that when we're going from city to city, making this ripple impact of the preventative health movement, whether it be the eye doctor showing up, and these micro movements, the micro movements are happening, like the Real Lives Touched by Addiction. I see this mobile clinic as another micro movement under FAM, and I'm not surprised that you're involved in it.
Well,
that is so cool.
Maybe we need to dream really big and
have
have a FAM plane.
Oh,
not a mobile bus.
And I know a pilot, literally,
Perfect.
and she's incredible. I was able to speak. Shout out to you, Whitney, if you're watching. I spoke at her Wallet to Wealth. She's in the Halton area. She's a passionate entrepreneur. She's empowers women in financial health. She is a FAMbassador loosely and need her more involved, but she's a pilot.
Perfect.
So you know what? You heard it here first. Whitney, that's a shout out. So you're going to stay with me for a couple more segments. We're going to be back and we're going to dive more into peeking through the window of the eyes into the body, into the health, and the lens of what you can do to change your outcomes at every age and stage of life. Stay tuned. We'll be back here with Dr. Teske in just a moment.